Good morning, everybody. I'm Levita Gingrich. I'm one of the RHPCs for South Central, and I know a lot of these faces, or I know a lot of these names, because I talk with you a lot. Eric can't be here this morning. Eric Weller is the other RHPC for South Central, and we're just so happy that you could make it here today. We were so excited. Our coalition won. We had the most people sign up that we had to make some really good accommodations, and we're super happy about that. So I'm the person you reach out to if you need something for long-term care or for hospitals. So my contact information is available if you don't have it. I'm going to turn it over to Erin.
Good morning, my name is Erin McLaughlin and I'm from the state, from the Minnesota Health Department, and I just wanted to thank everybody for being here today. And yes, Levita is right, they totally won. You guys blew out the registration fee, so we can't thank you enough for taking the time to be here. Essentially what it is we're videoing this for folks that couldn't come, that they can watch it at home. But really looking forward to the day, and thanks to Mia and her team for coming and doing this great training.
All right, good morning everybody, welcome. My name is Emily Moylan and I am with the Metro Health and Medical Preparedness Coalition. Thank you all for being here today. If you don't know who the Metro Coalition is, I'm assuming you do, it's probably why you're here. But just in case, we are a federally funded, so funded through a federal grant organization whose goal and mission is to work with healthcare facilities in our 7-county metro area and assist you with your preparedness and response planning. As I said, we are funded through a federal grant, and the preparedness work that happens at the state health department is as well. And so this training today is sponsored through some of that grant money, and we're really excited to bring on Mia and Steve from Vital Learning Strategies to take you through a day of learning around basic emergency preparedness and response concepts to help you elevate what you're already doing at your own organizations. I'm here throughout the day. I'm not teaching, but I'll just be hanging out in the corner, so please come introduce yourself or say hi. I see some familiar faces already. And I mostly work with long-term care, home care, and hospice, but if you are a hospital or a clinic, certainly come say hi as well, and I can get you in contact with my colleague, Chris Chell, if you have hospital or clinic-specific questions. But otherwise, really happy to have Mia and Steve here. It's going to be a great day, and I will let them take it away and tell you what's going to happen today.
Okay. Great. Good morning, everybody. What a great group. We're excited to be here after so many months and weeks of planning. My name's Mia Allens. I'm the founder of Vital Learning Strategies, but before that, I spent 15 years in public health and healthcare in the learning space. I came into the field as an educator, kind of knowing nothing, very little about emergency preparedness. I was an emergency preparedness educator, knew a lot about education and working with communities. Over time, I pursued my own learning in the education space at learning design and education. And then also over time, I had that other duties as a sign piece in my job description grow into eventually carrying a pager and then being in charge of a response or two, the smaller ones, and then maybe being in charge of some things during a global pandemic, and then, but then people turning to me, even though I was always in the education space, saying, can you actually, when we're going to update a plan, can you help us update the plan? Can you write a plan? So this kind of over time, really growing into that emergency preparedness and emergency management role, as we all do if you stick around long enough. I had that educator and learning designer view into things. So that's what I bring to this. I worked with coalitions, with healthcare facilities, always designing the training, and then living that experience myself, watching myself, kind of constantly learning, never being entirely comfortable, right? Every response is new. There's always something going on in your personal life. There's always something happening, a new system, something breaks. Nobody knows how to transfer the phone, right? That was always something in ours. And then the whole response, you miss things because nobody can transfer the phone. Anyway, things like that. So that's what I bring to this, is really kind of my love of learning combined with that love of the emergency preparedness, and really doing what all of you do, is like leaning in and having to do this role, because at the end of the day, we're responsible for caring for people. So we've got to work on the emergency preparedness stuff. I'll let Steve introduce himself.
Good morning. My name is Steve Montero. I started my healthcare career in hospitals, trained as a pre-hospital paramedic, and then got into emergency management in hospitals in around 2006 when that was just becoming a more regulated environment. If you think back to Katrina, there were many hospitals that passed the regulation that then suffered that devastating flood post-hurricane and never opened again. So I got into hospital emergency management as the regulation was ramping up. Served 15 years at Boston Children's Hospital working in the emergency management space as well as other duties as assigned. And then during that journey, joined a federal disaster team, a disaster medical team, and you'll hear a little bit more about that team or those teams in general as we go throughout the day. And I've been consulting the last couple of years for hospital systems around emergency preparedness and emergency management.
Good, thank you, Steve. This Mentimeter poll, we'll be using polling throughout. I'm a big introvert, so I'm a fan of these kinds of things because it's a lot. People tell me I'm not an introvert because I do this. Actually, I am. I'm going to go home and be in my pajamas on the couch later, right? But this helps really kind of get your thoughts out there. It helps us not be limited to the airtime that individuals can have. So we'll be using this throughout. We'll also, there's a couple key questions that we're going to share back the answers to you next week when we send out your certificates. So treat it as like a way for group note taking. But so go ahead, once you hook up to the poll, it will stay active on your phone, just in your browser for the rest of the day. But let's see, what word comes to mind when you think about emergency preparedness? Protecting our facility, I like that. Responsibility, leadership, and required. Those are good ones, right? You have to do it. We got a lot of requirements. And leadership, there's a lot that could be there in leadership. You have to work with leadership, or you have to step in and lead in your own way. Practice is making it front and center. Teamwork. Confidence, thank you for that. I think confidence is what I was speaking to about, my own journey, kind of always feeling underprepared or a little bit uncomfortable, and it's just over time I had to gain confidence myself that I got this, I can do this, no matter what role I'm playing, and it doesn't mean I have to know how to do everything, right? But you have to know how to just navigate that in the response mode. Thank you. Structure. Communications, we'll be talking about communications. Yeah, so welcome. Plan, Prepare, Act, Practical Strategies for Emergency Preparedness and Response in Healthcare Facilities. This curriculum we worked with the Department of Health and a working group of RHPCs from the coalitions like Emily's team, starting back in the spring, and really this is custom designed for, again, by the coalition regional healthcare preparedness coordinators for Minnesota, for the Minnesota Coalition. So I'll speak more to what we've done, something unique that's really meant for you. You'll hear me say this a lot throughout the day. I'm a geek, I'm a nerd. When I register for training programs, I read the learning objectives. I read everything they put out for us before you register. So you may have read these. You may have just been told to come or heard from someone that it was a good time. So you may not have read these, but I'm not going to read them to you. But I will say we're going to cover a lot today. Just look at these. Look at what we're doing here. Core components and best practices. We're going to talk about operationalizing and continuously improving your plans, risk assessments, communication strategies, stakeholders, resources. Any number of these things we could do a whole day workshop on, right? We could spend a week just on communication strategies if we wanted, right? What we're not going to. We're going to be covering some things. We'll go deeper on some things. Remember, I talked about we developed this curriculum with a working group. So when we're stopping for a discussion with the Mentimeter or an activity, we're going a little bit deeper on something that's intentional and on purpose, that the group, we all felt and really thought hard about what are the things we should pause and take a little more time on, that those we think would be the most useful. And then there's some other things that we'll take a little less time on. There's a lot of room in this curriculum for you to add yourselves. Every session is going to be indicative. What you learn is what we're putting into it today. This is our learning community today. So lean in, do offer your own thoughts. But nevertheless, there's going to be some things where you're like, I want to hear more about that, and then we move on.
I'm Seth Coffee Girl. I'm Marla Richardson. I work for MDH, and we, in partnership with Coalitions, kind of came up with this whole idea and engaged Mia and DLS, and so we're really happy that you guys are here, and we're super excited that you guys get to take this class, and hopefully can learn a lot from it. So, but yeah, I'm from MDH. Coffee is here.
Okay, everyone all set? So as I said to some other folks, if you were taking the pre-assessment and just scratching your head at a lot of those questions, that's a good thing, right? The post-assessment, newsflash, post-assessment is exactly the same. In fact, you notice we were short on printing. Some of them had post crossed out and just said pre. It's the exact same thing. We're not trying to trick you. The assessment is a way to measure learning. It's a way to evaluate the workshop and our teaching overall. So again, if you didn't know all the answers, that's good. You should know all the answers by the end. Each slide that has an answer on it has a little gold star. And many of the answers are literally written on the slide, not all. So again, not trying to trick you at all. Assessments they're meant for assessing and evaluating a training. They also, though, reinforce learning, right? So good assessments, again, trying to select the questions, although it's hard, most of what you'll be pulling away from today is not something we can test on a multiple choice question, yet here we are writing multiple choice questions. But try to make them the meaningful ones so they will reinforce your learning just by having to remember those 10 things. Okay, here's our agenda. That morning break is a little bit more of a suggestion than sometimes we're able to break it up into 2 because we get a little bit long in here. I just will say heads up, sometimes the conversation is so rich in the morning and we really want to help support that. We want, if you're bringing questions in, and someone's bringing in a question that's really relevant to many of you, that we can dive into that a little bit. So lunch is at 12:30. Be prepared for it to go as late as 12:40 or 12:45. So again, pastries and fruit in there if you want to kind of stock up and on the break to eat now, okay? Because we can speed up more in the afternoon if we really find like we want to dive deep in the morning. Then we have lunch. I think it's a nice day. We can eat outside. We have some boxed lunches coming in. And then remember I said that we'll be going over things and then moving on. You'll be wanting to learn more, and then we move on. By the end of the day, you're going to say, wow, we just covered a lot. What I want to do, we designed this to really honor the time that you're spending here. Again, all of you have so many things on your plate in your personal life, in your work life, and here you are, you're going to spend 8 hours with all of us in this room at this community center. So we want to make the most of it. Right? We want all of you to lean in, and we want the learning to stick as much as possible, which is a really hard thing, right? If you go into how the human mind is designed, to get something to really stick is a hard thing. And one of the most important things is to actually have a way for the learning to continue afterwards. So we'll all leave at 4:30, and within a few minutes, you're going to remember that you're running out of dog food or milk or, your kid has an emergency errand to get a white hoodie. That was our last workshop. That's going to happen. So what we have is in the back of your book. And I'll show you that. I'll show you the book more in the next slide. In the back of your book, there's a place to take notes, and at the end of each module. And that's because here in this module 9, we're actually going to spend time taking it home. So we could end the training here and then just do a post-test, but instead we're going to take a half hour to say, what did we learn? What does it mean to me? What am I going to do? Who do I need to talk to? What is the actual actionable thing I'm going to do, or the 5 actionable things that I'm going to do to carry the learning forward, okay? Because we say at the end of the day, Steve and Mia go home. You are home already. What happens next? That's entirely rests on your shoulders, right? We've designed this. One of the big goals of the working group was to form connections, to form relationships. So do that, and again, we have a couple things in the curriculum to really help that. We want you to connect with each other. Again, continuing the learning can be having somebody new that maybe is working on the same thing as you, or maybe already did a couple years ago and has something to share with you, or you're the person that can share, or someone you can turn to for XYZ thing that you're finding really important here. So one of the things with that in mind, at lunch, we're going to change seats. You're going to try to mix it up and sit with a new group of people so you have new relationships in the afternoon, okay? Okay, here's where I'm going to talk about your materials. We have two things here. We have a participant guide, and we have a resource guide. Let's talk about the participant guide. The participant guide is the resource that you use most today. It's got all the agenda and the slides, and you can take your notes on it. And then there's a little tab. And behind the tab is any time just a couple times we're going to do an activity that you're going to write something that's going to be behind the tab. Okay? So those are your worksheets, including the very last one. It's 3 pages, I think, where your take-home action plan, starting on page 44, that's got the space to take notes that we'll pause at the end of each module. Again, we've heard pretty consistently from the people who have done this that was, in fact, an evaluation form, some people have written that was the most useful thing. So I'll just encourage you to make use of it. What's the worst that happens? It's not yet useful for you. But if you don't do it in the morning, you kind of can't go back and retrieve those thoughts. So that's the participant guide. Then we have our resource guide. It's got all sorts of resources organized by module. It has a few things like on page 9, where this is content that could have gone in the participant guide. We're going to be doing an activity on it. We've put it in the resource guide because this is the thing that you might be using next month more than the other one, right? This is the thing that might last. You'll notice, if you open it, like a lot of the pages have a lot of text and blue underlined text, right? Blue underlined text, like I'm looking on page 3. There's a lot of text and blue underlined text. Those are hyperlinks. Can't click on them. It's a piece of paper, right? What good does it do you here? So that's why we have here, this QR code goes to our workshop Google Drive. There's 4 files there. 2 of them are these. They're in PDF format. So you can grab those, and that's where you get this in PDF format so you can click on all of the things, okay? This QR code, and I'll say that all of our QR codes are clean. We didn't use a free QR code generator that's going to put cookies on your phone or anything like that. So this is safe to use. It's generated by Canva without a plugin, very clean. We're going to keep this up through December. At that point, we'll take it down. These materials will be going to the Department of Health and working with your coalition. It will live somewhere else, just not on our drive. So. We might make some updated things, the videos and all of that. They'll go live somewhere, but you can grab this for now, okay? They're pretty well refined by this point. This is the 7th of 8 workshops in person, so, but if we do make any more changes, the file names have the date in them, so you'll know if there was a change from the one you got today. But they're pretty good by now, okay? So that's where you get that. That's about the materials. All right, let's talk about who's here today. And actually, this is a good reminder that I should have said in the resource guide. I knew there was something I was missing. On page 3, in particular, there's a new, there's a lot of long-term care facilities here. This was the registration as of last week. A lot of people, some people have had issues come up with their facilities and they couldn't come today. But so all the data we have on the slides for your session are the data as of last Thursday. But regardless, a lot of long-term care facilities. So we just really want to point out that there are some long-term care, there you go, communication plans, templates, and the long-term care preparedness toolkit on page 3. And then the COOP tool, the continuity of operations plan, COOP toolkit and trainings, that's brand new. Phenomenal job done by the team at MDH a group that worked on that. So that's brand new. If you didn't see that, really encourage you to look at. Really great toolkit, really usable for your facility. Okay, so lots of long-term care. Hospital, we got you seated by facility type. Lean in, we're going to go through some scenarios. Just adapt it to, we want everything to make sense for you. We were talking in the back, clinics is a very different environment than a long-term care. Where was our hospice person? Oh, we got a couple hospice. You're just going to take it in and adapt it for you, for what makes sense. There's a lot of things that are common to all of us, no matter the kind of facility type. And then there are some things that are unique. So let's just mix it up again, lean in, ask questions, learn from each other, because there are a lot of things that are cross-cutting. And then there are a lot of things that are different. It's also important and great to learn about the things that are different when you're in a learning space like this, because we're all part of a continuum of care, right? We're all part of a system. We all need everyone to stay functional as much as possible. So I always find it interesting to hear new things about the different facility types that I hadn't known before. Let's talk about experience in your emergency preparedness role. We had a lot of people that are brand new and welcome. Who is in our less than 1 year space? Okay, so you're in the right place. Look, everyone here wants to help you learn. Everyone here was at one point in the first year, right? Who's kind of still new, 1 to 2 years? And you could be in the emergency preparedness space. Like I said, I have 15 years and I was still learning things and still feeling uncomfortable. It's like it's not like some other jobs where you're like, I got this now and I'm doing the same thing. So in the 1 to 2 years, how did you learn and get your feet wet and get any tips for the people new coming up? Because it's still fresh in your mind that you were brand new. Do you remember what it was like? Just going through it. Just put one foot in front of the other. Just keep going. And eventually you just found you learned. Yeah. We used to tell staff, brand new staff that were new to the field, it's going to sound like mumbo jumbo for at least 6 months. At least 6 months. It's not you. You're not stupid. I promise. But at about the 6 month mark, you start understanding the acronyms and all of, something clicks. We have a good about 3 to 5 years in your role, in your emergency preparedness role. Rough, I can't really remember. It was a pandemic. I don't remember really when I started. And more than 5 years? And that's, I think, what's great in this field. It doesn't matter how long you've been around, there's still something to learn, right? So again, just kind of looking around, and that's helped to bring the experience out today and for you to meet and learn from each other. We're going to do introductions. Remember, one of the goals is really to meet and learn from each other as much as it is to learn from Steve and I. So this is how we'll do introductions rather than going around one by one. When I say go, we're going to all stand up. And you're going to meet as many people as you can. Give them your name, where you work. And I'm going to modify this. But the idea between one thing you enjoy doing outside of work is, come on, let's get real. Your personal life and your loved ones and your community are what's most important when something bad happens, right? To you. I mean, that's what if you're in a response role and you're working in a facility, you're still thinking about and you need to make sure everyone that you care for is safe, right? Also, as we learned especially through the pandemic, taking care of ourselves is the number one important thing. Because if you don't take care of yourself, how can you take care of your facility and your patients or your residents, right? So bringing your whole self to this work is really important. So I would say you can say one thing you enjoy doing outside of work, or you can also say, where did you go on MEA week? We'd also like to hear that. So I'll give you 10 minutes, as many people as you can. right, isn't that great? It's always hard to pull people back. So this is the energy we're going to keep. You're going to help us keep. We're going to be interacting with each other and learning from each other. So go ahead. This is our first. I'd love to hear what you hope to gain from today's workshop. If you did the other Mentimeter, you should still have that on your phone. If you didn't yet, there it is. And so go ahead. What do you hope to learn from today's workshop, or what do you hope to gain, which is a slightly different question. You can gain things just by being here. And while you go in and answer that, and we'll talk a little bit about what we're going to do, what we'll do, and what we might not touch on today. I'll pause for a minute. What brought you here today? You were like, yes, I'm going to come spend 8 hours at the community center. Maybe it was for the lunch. New perspectives in management of incidents. That's awesome. We'll have some new perspectives just because you haven't met us before. Everyone in this room is going to bring in a new perspective. In fact, that's where I always love people who are new to the field to chime in the most, because I've been doing this for too long. So the people most likely to have a new perspective are the people that are new to it, I think. I'm going to take that down. Better understanding. Confidence. Strategies for your EOP. Improve your current plans. Improved understanding of the incident command structure. You will definitely get that. I'll speak to that later. Meet additional people to contact. That's great. Meet people here today. And actually, that's a moment on the sign-in sheet. I meant to mention this earlier. There was a column at the end that said consent to share info. Let me explain that. That wasn't about, we're not going to use your information for anything other than sharing it amongst yourselves. So if you want to change your answer because it sounded kind of creepy, feel free to do that. We'll leave the sign-up sheets out. But the idea is, again, we want you to be able to continue the conversation. If you meet someone here today or you didn't manage to get their email address, that's what that's for. So again, when we send out your certificates, we'll send out some Mentimeter poll question answers, and we'll send out a list of these are the people who said, yes, I want everyone in this room to have my name and email address. That's all we're going to do. We're not going to save it. We're not going to send you spammy marketing emails, I promise. Continue to learn how to have a clear plan, that easy access and share. We're definitely going to hit on that. New tools to help enhance emergency planning. That's great. I'm just going to scroll through these so everyone can see. Get a great plan. Awesome. There's that building confidence piece. Refreshed and concise strategies for the EOP. Steve, take note. Confidence in preparing for the unexpected. Formal emergency preparedness process. Anyone want to speak to that? That was yours? I'm wondering I'm wondering a little bit more about what that is, the formal emergency preparedness process. Process to developing the plans, or process to using the plans in a response, perhaps? I think we'll get at this a little bit. Ooh, the infection prevention role in an emergency. Effective leadership. I think we'll definitely get at that. Great. That's wonderful. Thank you. Yeah, that's great. I think we're going to get at most of that. And if we didn't, like the infection prevention, there was a couple of things that were real specific, you might find an opportunity to ask a question or make a point and help us get there. Oops. That is it for Module 1. So our goal today is learn from one another, collaborate, increase your readiness, and most of all, have fun. The more fun you have, the more you learn, also scientifically speaking. Okay, so I'll hand it over to Steve.